If you've just been handed a prescription for Prevacid 30 milligrams, Lansoprazole, or you're wondering why your stomach won't settle, you need to know exactly how this medication works before you take your first dose, what it is and how it works. Prevacid 30 milligrams, Lansoprazole, is a type of medicine called a proton pump inhibitor, or PPI. Your stomach has tiny pumps that create acid to digest food. Prevacid 30 milligrams, Lansoprazole, works by blocking these pumps, which significantly reduces the amount of acid your stomach produces. This is why doctors prescribe it for indigestion, heartburn, acid reflux, GERD, and even to prevent or treat stomach ulcers. In the UK, it is prescription only and usually comes as capsules or tablets. Who should not take it? But before you start, it is critical to know if this medication is actually safe for you. Most adults and children can take it, but you should avoid it if you've ever had an allergic reaction to it, or if you have existing liver problems. If you are pregnant, breastfeeding, or planning to become pregnant, you must consult your doctor first. Also, if you're due for an endoscopy, a camera test to look at your esophagus, your doctor may ask you to stop this medication a few weeks beforehand because Prevacid 30 milligrams Lansoprazole can hide problems that the camera is meant to find. How to take Prevacid 30 milligrams Lansoprazole correctly. Now, how you take this medication determines whether it actually works or just sits in your stomach doing nothing. Most people take it once a day, first thing in the morning, though some take it twice a day. The golden rule is to take it at least 30 minutes before a meal or snack. Eating too soon after can actually stop the drug from absorbing properly. If you struggle to swallow capsules, you can open them and sprinkle the granules onto soft foods like yogurt or applesauce. Dosages typically range from 15 milligrams to 30 milligrams, but your doctor will tailor this to your specific condition. How long to take Prevacid 30 milligrams Lansoprazole? A common mistake people make is stopping too early or taking it for too long. You may start to feel relief within a few days or weeks, but depending on your condition, you might need to take it for a few weeks, months, or even years. However, because PPIs can have side effects, you should take them for the shortest time necessary. If you forget a dose, take it as soon as you remember, unless your next dose is due in less than 12 hours. In that case, skip it. Never take a double dose. Common side effects: Prevacid 30 milligrams Lansoprazole. While Prevacid 30 milligrams Lansoprazole is generally well tolerated, your body might react in ways you need to recognize. Common side effects include headaches, nausea, diarrhea, and stomach pain. For headaches, rest, drink water, and avoid alcohol. If you feel nauseous, stay away from spicy or rich foods. If you have diarrhea, drink plenty of fluids to avoid dehydration. And if you're on the contraceptive pill and experience vomiting or severe diarrhea, your contraception may not work effectively. So check your pill packet for advice. Pregnancy and breastfeeding of Prevacid 30 milligrams Lansoprazole. Finally, if you are pregnant or breastfeeding, you need a slightly different approach. Prevacid 30 milligrams Lansoprazole is not usually recommended during pregnancy because there is limited safety data. Your doctor may suggest a similar medicine called omeprazole instead, as more is known about its safety. If you are breastfeeding, it is generally considered safe as very little passes into breast milk. You can also try non-medication options like eating smaller meals, avoiding fatty foods, and propping your head up while sleeping to let gravity keep the acid down. To wrap up, always take Prevacid 30 milligrams Lansoprazole 30 minutes before food. Stick to the shortest duration possible, and stay alert for side effects. If you're unsure about anything, speak to your doctor or pharmacist before making changes. If you have any questions or want to share your experience, drop a comment below. If you learned something new, give this video a thumbs up and subscribe for more weekly medical insights. Thanks for watching.